The local rates of infections are very low. And look, if she saw an outbreak of infections, I'm sure that might change the calculus. But when the American people see an athlete running on a track and field area pass out because they're wearing a mask outdoors, I think people have a right to question right now a lot of the guidance that we're getting nationally. Yeah. And I think we got to turn to local doctors and nurses.
And on that note, I want to play this soundbite from the CDC director, Rochelle Walensky, because it kind of plays into your op-ed that you wrote where maybe we're fueling fears. Watch this.
Although we are seeing progress in terms of decreased cases, hospitalizations, and deaths, variants are a wild card that could reverse this progress we have made and could set us back.
You said in your op-ed, Dr. Makary, that maybe we shouldn't buy into all this talk about the variants.
That's right. Look, we've had dozens of variants, and they're all entirely encompassed by the vaccine and preventing serious outcomes. So we got to be careful right now and not scare people. People need something to look forward to. And if you look at the numbers, we're doing really well right now, Trace.
Yeah, we are doing well. And what's your thing? I mean, you know, you talked about this a couple of months ago. You said, look, we are 2 months away from herd immunity. Are we there? Are we getting closer? Is it ever going to be fully realized in your estimation?
Well, unfortunately, we have this perception now that's being created by some public health leaders that we need to reach total eradication. And we're not going to get to total absolute risk elimination. That's a false goal. And quite honestly, it's being used now to manipulate the public. We heard today again from our public health leaders that if we get to 70% vaccination, then we could start seeing restrictions move. That's dishonest. Most of the country is at herd immunity. Other parts will get there later this month. San Francisco had 12 cases yesterday, Trace, most asymptomatic. What do you call that? I call that herd immunity. And I think what's happening is our public health leaders are dismissing natural immunity from prior infection, which changes the path to get to more population immunity. It invokes mandates. It means kids may have to get it. And it demonizes those who are hesitant rather than respecting their decision.
Dr. Marty Makary, always good to see you, sir. Thank you.
Thank you, Trey.